My name is Alicia Chisholm. This is my health assessment video. So this is my patient Dixie. Normally when a patient would walk in a room, I would assess for clothing if it was appropriate. Hers is. As they move, I would assess her gait and her posture, both of which her posture was erect, her gait was smooth. I would also be assessing her facial expressions as I spoke to her and welcomed her to the room and noticed that she has good facial affect. And then I would have her to be seated. At that point, I would wash my hands before ever touching the patient. Wash my hands to rid themselves of germs and contaminants. I like to do that in front of a patient so that they're able to see that their safety is important to me and that I have clean hands before I start touching their body, which promotes a feeling of safety with them. So let's begin. Hi, Dixie. So today we're going to be doing a physical assessment. It's going to take about 15 to 20 minutes, hopefully. And I'm just going to be assessing you, basically start at your head and working my way down your body to about your abdomen, about your hips, okay? I'm going to be asking you some questions throughout. If you'd answer those, I'd appreciate it. Also, if you are uncomfortable or have any questions, please let me know immediately. Is this room comfortable for you? Are you not too cold? Everything's good? Okay, all right, then let's begin. So, Dixie, can you tell me your name and date of birth, please?
Dixie Chisholm, 05/16/1998.
All right, and can you tell me the address of the location where we're at today?
3210 Highway 267 South, McRae, Arkansas.
And today's date?
June 29th, 2019.
So the patient's level of consciousness is alert and oriented ×4. We're going to check her recent memory. Dixie, can you tell me what you had for lunch today?
A turkey sandwich and Cool Ranch Doritos.
Okay, good. We're also going to check your remote memory because I'm going to give you 4 words to remember. And then I'm going to ask you to repeat them to me several times throughout the rest of the physical examination, okay? The words are fun, carrot, ankle, loyalty. Okay? Fun, carrot, ankle, loyalty. I'll let you say those back to me.
Fun, carrot, ankle, loyalty.
One more time.
Fun, carrot, ankle, loyalty.
Okay. So we assessed Dixie's vital signs before she came into the room. Her temperature was 98.7. Her heart rate was 132/70. Her pulse was 69. Respirations were 16 breaths per minute, and pulse ox level was at 100%. These are all within Dixie's normal range. Dixie, are you in any pain today?
No.
Okay, excellent. So we're going to begin our assessment, and like I said, I'm going to need to be touching you throughout. I'm going to start touching your hair, so if that's okay. All right. So with my assessment, I'm able to tell that Dixie's skull is normal cephalic. Checking her scalp, I can see that no parasites and that her skin is appropriate for ethnicity. Her hair color is blonde. She has coarse hair with some curl to it. Assessing her facial features, I'm able to see her facial symmetry. I'm also able to note as she moves and talks that there's no facial droop, which assesses her facial nerve. Dixie, at this time, I'm going to perform a short test, and what it's going to require you to do is you're going to close your eyes, and then I'm going to gently touch different places on your face. All I need you to do is tell me where I'm touching your face, and please be sure to indicate whether I'm on the right side or the left side, okay?
Okay.
Could you close your eyes at this time, please?
Right forehead. Left cheek. Chin.
Okay, you can open your eyes now. Thank you. Because she was able to feel those sensations correctly and where I was touching, it evidences that her trigeminal nerve is intact as well. So Dixie, can you hold your hands up for me? All right, I'm going to gently squeeze the back of your hands. I'm checking for something called skin turgor, and yours is excellent, showing that you have plenty of water. Her nails are clear, they're translucent pink, and no clubbing is noted. Her cap refill is less than 3 seconds. Moving back up to your head, Dixie, I'm just going to be moving throughout. So her eyebrows are, can you wiggle your eyebrows up and down for me? Good. Symmetrical in their movement. There are no lesions. There is no scaling noted either. Her eyes are clear. There's no discharge noted and no lesions noted. Her eyelashes are everted and equally distributed across both the upper and lower lids. At this time, I would assess her optic nerve by asking her to read from the Snellen chart. She would stand up at a mark on the floor 20 feet away from the Snellen chart on the wall. If she was wearing, was wearing glasses, I would ask that she leave those on. And if she was wearing contacts, I'd also have her leave those in as well. She would cover up her left eye and then read the chart with right eye only. Cover up her right eye, read the chart with left eye only. So after assessing optic nerve with the Snellen chart, I would move on to my physical assessment of Dixie's eyes. So Dixie, I'm going to ask, we're going to check to make sure how your eyes move within. So if you would please, I want you to watch the tip of my finger, and as I move it around, just follow with your eyes, don't let your head move, okay? So as I move my finger, I'm assessing Dixie's oculomotor nerve, which appears to be intact, as well as her trochlear and abducens muscles, which are also proven to be intact, with the full movement with no nystagmus evidence. At this time, the room is dim enough that I'm able to assess her pupils without turning off any lights. So Dixie, I'm going to have you look straight ahead. I'm going to shine a bright light into your eyes. So if you could just hold your eyes open, it won't take but a moment. Okay? Here we go. I'm able to observe that Dixie's pupillary response is consensual. And if you will focus your eye on my finger right here, I'm going to slowly bring it towards my face, so keep watching the end of my finger. So again, the ocular motor is intact, and Dixie's eye pupils are equal, round, and reactive to light with accommodation. At this time, if I was using an ophthalmoscope, I would use that. So when you assess the patient using the ophthalmoscope, you want to make sure that if whatever eye you're assessing on the patient, you use that eye yourself. So you would hold your scope in your right hand, use your right eye to assess Dixie's right eye. You want to come to a 0 point, and you're going to be, so you'll be able to see the retina inside her eye, as well as looking for that red reflex. You're going to be looking to see if you have any dark spots within the retina that would indicate a lesion. However, if you have a nearsighted patient, you want to use the red lens. If you have a far-sighted patient, you want to use the black lens. So, Dixie, your ears. You need tenderness when I do this?
No.
Okay. Any tenderness here?
No.
Okay. So Dixie's ears are bilaterally symmetrical. There's no lesions or discharge noted. She has an ear piercing at each one of her lower lobes, just one, and no tenderness noted through the auricle, tragus, or mandibular process. At this time, I would use my otoscope to assess the inside of her ears. I would be assessing to see if I could, if there was any lesions or any discharge. I would also be assessing the eardrum. It should be a pearly gray in color, and it should lie flat, not convex or concave. Okay? So, Dixie, are you still doing okay? Alright, so back to facial assessment. I'm able to see that her nose is symmetrical with no deviation. I'm going to pressure on your sinuses, Dixie. I notice there's no redness, but I want you to tell me if there's any tenderness as I press across your face.
No.
Okay, so the maxillary sinuses show no tenderness, as well as the frontal sinuses. Okay, Dixie, can you put your left finger up against your left nostril and close it and take a deep breath? Okay, do the same with your right side. So nares are patent. If we were going to be assessing for the olfactory nerve, then at this time I would take and have Dixie occlude her left nair, and I would hold a swab coated in vanilla to her right side with her eyes closed, have her correctly identify the smell, and then occlude the right nair, hold it to the left side, eyes are still closed, correctly assess the smell. I also forgot that I do want to, when I do her ears, I want to assess her vestibulocochlear nerve, and I'm going to do that quickly. Dixie, if you could cover up your left ear, I'm going to lean forward and whisper a word. I want you to tell me what word you hear, okay?
Nursing.
Okay, that's correct. I'm going to use a different word on this side.
School.
Her being able to hear the words I'm saying indicates that her vestibulocochlear nerve is intact. So, coming back, her lips are pink moist and symmetrical. Looking at her teeth, can you open your mouth gently for me, Dixie? Her teeth are white and even and wide. Teeth are all present. Okay, I'm also able to see that her buccal mucosa is pink, moist, and intact. No lesions are present. Dixie, I'm going to press down a little bit on your tongue, open wide. So her pharynx is pink and moist. Her tonsils are intact at a +1. Okay, this time I'm going to push down your tongue. I want you to say ah. Say ah for me.
Ah.
Okay, I'm able to see the uvula move up, indicating that the vagus nerve is intact as well as the glossopharyngeal nerve as well. Okay, have you opened your mouth, touch your head back just a little bit. I'm going to look at the roof of your mouth. No lesions present, pink in color, moist. Dixie, can you, let me see your tongue. Underneath, excellent. Open your mouth just a hair wider. There you go. Tongue is pink, moist, intact. Can see the veins on the bottom of her tongue, and saliva is present. Can you stick your tongue out at me? Which indicates that your hypoglossal nerve is intact as well. Okay? All right. So, as we move down, I'm going to assess your neck. Okay? And so, first of all, let's let you kind of loosen up and get some stretches in, okay? I want you to lean down and touch your chin to your chest. Good stretch. Turn and look to the left. Turn and look to the right. All right. Now, I want you to lean your head over to the side, left ear to left shoulder. Don't let your shoulders come up. Right ear to right shoulder. Good. Now just tilt your head back. Good. Excellent range of motion. No crepitus noted. So I'm going to press down on your shoulders, and I want you to kind of push up against them, okay? Don't let me push your shoulders down. Excellent. Now I'm going to push against your face, push back against my hand. Push back against my hand. Excellent. So her accessory nerve is intact, as evidenced by the strong and equal resistance to movement. All right, so Dixie, what I'm going to do now is I'm going to assess your lymph nodes going down your neck, okay? Her neck is appropriate skin tone. It matches her facial skin tone, and we're going to go through each one of them. So our preocular, preauricle, posterior auricle, occipital, submandibular, submental, the tonsillar or jugular digastric, and then the, not superior, I always saying the wrong clavicle, or the cervical, superior, I apologize, superficial, I apologize, superficial, cervical, and then the posterior cervical. Okay, Dixie, I'm going to let you tilt your head gently to the left. There you go. And I'm going to come to an area right there that's your deep cervical. Okay, can you tilt your head to the right? Don't mind getting my fingernails into you. Okay, now I want you to hunch your shoulders forward. Just excellent. I'm going to assess your supraclavicular. No lymphoedema is present at this time. Okay, now I'm just going to check your pulse. We're going to want to do that one side at a time. Make sure you get good brain flow to your head. I'm also going to listen to it, if you don't mind.
No.
Okay. Take a deep breath and hold it. Okay, let it out. Breathe normal. Take a deep breath and hold it. Okay. Just breathe normal now. So her pulses were equal and at a regular rate. No bruit was noted, as would indicate a carotid arterial disease. So, going to keep moving down. Going to be assessing your chest. And I'm going to need to see your chest. So if you could remove your shirt. I know you have a sports bra on underneath that. Okay. Thank you very much. Okay. Visual assessment, I'm able to note that the AP versus transverse is 1 to 2. And then I'm able to see that her skin tone is appropriate for ethnicity, and it matches all the way down, no redness or irritation noticed. I'm going to gently squeeze right under your clavicle just a little bit and checking for skin turgor, which again is good. And then I'm going to have you, I'm going to move my hands down your chest and have you say the word 99 over and over again, okay?
Okay.
Okay, so say 99 for me.
99.
Again.
99. 99.
I know this, I'm going to move your breast just a little bit, say 99.
99.
Okay, if you would please, can you turn? If you'll just stand up and turn, put your back to the camera. Okay, I'm going to have you say the words 99 again.
99.
Again.
99.
Again.
99. 99.
And right up underneath the edge of you.
99.
Excellent, okay. No tactile fremitus noted. You can have a seat back down for me, please, Dixie. Okay. All right. So I'm going to see how, actually I'm going to let you, I'm sorry for having you stand one more time. Okay. So I'm going to just gently squeeze. No, take it, you're fine, just relax. I want you to take a big deep breath for me. Relax. Okay. Good chest expansion. Now you really can sit back down. I'm going to tap and make it'll make a funny noise, but that's okay. This is flat because it's definitely over bone. But I'm able to hear a resonance when I'm over lung tissue. So, let's see how clear your lungs are today, okay, Dixie? While I'm listening, I'm listening to several different places on you. What I just want you to do is take some nice, easy, deep breaths. Not big, huge breaths, but just some nice, deep ones, okay? Your heartbeat. Okay, I'm going to move your breast slightly so sit good and straight for me. There you go. Nice deep breath. Okay. One more. Okay. Now, can you relax your arms kind of up the side? I'm going to need to listen down your sides a little bit. Okay? All right. Nice deep breaths here. Okay, nice big one. All right, one last time. Okay, excellent. Now, so that we can easily see from the camera, I would just stand behind you, but if you'll turn, I'm going to listen to you again. So please continue breathing those nice, easy breaths, okay? Nice, big breath. Okay. I'm trying to sit down. All right. So if you'd like to put your shirt back on. So no adventitious breast downs were noted. Both lungs were clear bilaterally. Okay, there you go. At this point, I would conduct a breast exam, but we're not going to do that. So, Dixie, I'd like to talk to you about the fact that you need to be doing self-breast exams at home, okay? And all that entails is not a big deal. So at this point in their examination, I'd like to speak to you about conducting self-breast examinations. It's not a big deal, but daily, weekly, when you're in the shower, it's good to pay attention to if you notice any lumps emerging, any dimpling or retractions where it pokes back in. Raising your arm above your head, look in a mirror and see how if your breasts are symmetrical, if you notice anything odd, if your nipples are inverted, going inward, it can appear that way, or when you raise your arms over your head, does one breast go up and the other one not? Okay, these are all good times to contact your doctor to screen for cancer. Okay, so I would also do a breast exam at this time, and what I would have the patient do is, one, she would remove her bra so that I would be able to assess skin color, see if it was appropriate for ethnicity, if there was any red places, also be able to notice if there was any dimpling or retractions, any lumps that were visible. I would be able to see that the skin of the areola was pink in color and the nipple is exverted, not inverted. Then I would have the patient, after doing my visual assessment, I would have her raise her hands above her head. Could you raise your hands above your head? And then I would have them put them on her hips, and then I would have them press against each other, grasp. And this would be able allow me to be able to see if there was symmetry in her muscular movement to make sure that one breast did not rise and the other rose, and the other did not. And so hopefully this Dixie would have symmetrical breast movement at this time. And so after assessing for symmetry, I'd have the patient lay back, and I would do my manual assessment. I prefer vertical strip, where you're going to take 3 hands doing alternating pressure in a rolling motion. You move down the breast from the lateral side towards medial, and you're going to move down the breast and then back up in a rolling motion, assessing for lumps, dimples, retractions, any also for painful sides. When you were finished with both sides, you would also gently squeeze the nipple to check for any discharge. And at that time, my assessment would be done. Thank you.